Good afternoon, everyone. Welcome to our session today on the quality reporting program. So the deadline for right now, the Q1 2024 deadline is actually tomorrow, August 15th. So we want to just take this opportunity to make sure that you're up to speed with what the skilled nursing facility quality reporting program is. We'll walk through various components of it and then have some time for questions and answers at the end of the session. My name is Joshua Clodius. I'm a licensed nursing home administrator and a senior quality improvement specialist with Health-Centric Advisors. We are a member of the IPRO QIN-QIO. If you're not familiar with the IPRO QIN-QIO, IPRO specifically holds the contract for the Medicare QIO contract region shown here, excuse me. IPRO specifically helps support New York, New Jersey, and Ohio. Health-Centric Advisors help support Connecticut, Maine, Massachusetts, New Hampshire, Rhode Island, and Vermont. And Clarent helps support Maryland, Delaware, and the District of Columbia. Together, we are three organizations under the IPRO QIN-QIO banner. So if anyone asks if you're working with IPRO or Health-Centric Advisors or Clarent, you say yes. So just to walk through some learning objectives for today's session, we're just going to review elements of the Skilled Nursing Facility Quality Reporting Program known as the SNF QRP. We'll talk about the potential that it has potentially on your organization, the impact it's going to have, and then any considerations and things that you can do going forward to have a positive impact. So let's dive into it. We're going to go over a quick review of the elements of the SNF QRP, what it is, and the components behind it. So the SNF QRP, this is now several years old now. It started, the requirement started back in October 1st, 2016 as part of the Impact Act of 2014, which mandated the facilities to be part of this. And essentially, it creates quality measures and data uniformity across post-acute care settings. And facilities who are not in compliance with these quality measure submission requirements, they are then subject to market an annual payment update reflected in your market basket adjustment and such. So the goals behind the Impact Act were really to create data uniformity across the post-acute care settings as it relates to shared decision making, care coordination, enhanced discharge planning, data interoperability, and payment reform, essentially. Essentially, it means that the home health agencies, inpatient rehab facilities, long-term care hospitals, skilled nursing facilities are all using standardized data that's measured the same way across all the post-acute care settings. And the measures have to do with functional status, cognitive function and mental status, special services, treatments, interventions, medical conditions and comorbidities, impairments, and then other categories that the Secretary of Health and Human Services have implemented. So again, the SNF QRP makes quality of care information available to residents, families, and patients so that they can make those informed decisions about their healthcare options. And it also encourages hospitals and providers to improve the quality of inpatient care that they provide to patients by ensuring that they're aware of and reporting on best practices for their facilities and types of care. So when we look at the SNF QRP measures themselves, the data for the SNF QRP measures are collected and submitted through three different methods. Number one, your MDS, minimum data set. Number two, your NHSN CDC data reporting. And number three, Medicare fee-for-service claims data. So what's important to know with the SNF QRP measures is that there isn't any additional reporting that you need to be doing for these measures. You should already be doing your MDSs. You should already be doing your weekly NHSN submissions and annual influenza vaccination reporting. And your claims data is taken from claims. So there's no additional burden associated with these quality reporting program measures. With the SNF QRP measures for the MDS, again, this is data that's being collected from your MDS, and that's submitted to CMS. via the keys and iKeys system. The measures are as follows. Uh, Application of percent of residents experiencing one or more falls with major injury, drug regimen review conducted with follow-up for identified issues, change in skin integrity for post-acute care, pressure ulcer and injury, discharge self-care score for medical rehabilitation patients, discharge mobility score for medical rehabilitation patients, transfer of health information to the provider, post-acute care, transfer of health information to the patient, post-acute care, discharge function score, and the COVID-19 vaccination, the percent of your patients and residents who are up to date with your with the COVID-19 vaccine. The CDC measures for which are NHSN that are associated with the SNF QRP are as follows. The COVID-19 vaccination coverage among healthcare personnel, and then the influenza vaccination coverage among your healthcare personnel. So again, this is data that's submitted into NHSN, what you should be doing already on a weekly basis and annual basis for the influenza. So again, no additional burden associated with these measures. Want to highlight and notice some key components about the NHSN QRP measures themselves is that as it relates to the QRP, NHSN compliance is determined whether a facility had reported for 1 week out of each calendar month within the 3-month quarter. So this differs obviously from the federal requirement of having to submit on a weekly basis. For the purposes of the QRP, they're looking for at least you've submitted at least once a month into NHSN. Obviously, you still have to maintain that federal requirement of weekly submissions into NHSN. But again, I just wanted to talk about that little nuance related to the NHSN QRP measures. And then lastly are the Medicare fee-for-service claim data measures, which are your Medicare spending per beneficiary, your discharge to community, potentially preventable 30-day post-discharge readmission measure, and your healthcare-associated infections requiring hospitalization. This is data that for these measures are again collected from claims, so there's no additional data that's needed to be submitted to the skilled nursing facility. At the QIO here, we've actually been getting a lot of contact from facilities who are receiving notification about not meeting QRP requirements and action that's being taken. So I believe notices had went out back on July 3rd, and you're able to actually find those in the iKeys folders. Your facility really should go in there and check to see if there are any non-compliance letters related to your MDS or NHSN submissions. Because again, all data must be submitted no later than 11:59 p.m. Tomorrow, August 15th. The notification might have looked a little bit something like this. Good morning. They're reaching out to you, yada, 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 about the August 15th, 2024 submission deadline related to the SNF QRP. When we scroll down a bit, you'll see towards the bottom that they're reminding you that skilled nursing facilities must also meet an assessment-based quality data submission requirement compliance threshold of 90% using data submitted through your MDS. Based on this notification for this facility, they ran that report as of July 15th, 2024. This facility assessment compliance threshold is only 88.89%. So they were not meeting the 90% threshold for this quality reporting program measure, and thus we're going to be impacted with it. So what is this MDS threshold that I'm talking about? So what happened last year, October 1st, 2023, prior to that, facilities had to have at least 80% of their MDS submissions 100% completed. So you needed to have at least 80% of your MDSs having all the data elements entered, no dashes, etc. They increased this threshold effective October 1st, 2023 to 90%. So now that means all your 90% of your MDS submissions need to have 100% of those required MDS data elements. So I know this is sort of a big change that many folks might not be aware of, but there is a penalty that's assessed to the facilities that do not meet this threshold. So there's actually some things and action items that you can walk away from today to see whether you are meeting measures or if there's some quick updates that you can make before the deadline of tomorrow. So there are actually some review and correct reports. You can look in Casper, you can generate these SNF QRP review and correct reports to look at various different daters and associated residents that are impacting the measures. And then you can also generate a SNF provider threshold report. So this is again generated in iKeys. You can run a fiscal year 2026 SNF QRP provider threshold report, and it can show you, this facility, for example, had 57 MDSs submitted, 51 of which were 100% completed, which gave them a 90% threshold. I personally would recommend going a bit over 90% just to have that little bit of a cushion. But you need to be making sure that your facility is meeting that 90% threshold because it is tied to the QRP and your financial performance of reimbursement. So again, after this meeting today, go and log into iKeys and generate this report. See where you're at with your MDS submissions are, and then start to go from there. Look at some of the MDSs that had been dashed that are not 100% completed to try to get this threshold up there before the deadline tomorrow. I had mentioned it earlier, the SNF QRP financial impact. Any facility that's determined to not be in compliance with the SNF QRP requirements are subject to a 2% point reduction in their annual payment update and this penalty had begun fiscal year 2018 and has continued each subsequent rate year. We're also currently in a measurement period for the fiscal year 2026 adjustments. Right now, you are being measured for various different quality measures that are going to be in effect fiscal year 2026. And that measurement period was October 1st, 2023 through September 30th, 2024. So in summary, really what I want you to take away from this is that non-adherence to the QRP is tied to financial penalties. There are also SNF QRP measures that are related to your 5-star rating, so you definitely want to be aware of what these measures are and how it's impacting your facility. And that the NHSN measures also have a potentially those CMP fines for non-compliance with NHSN. We still have a lot of facilities that struggle with this, continue on a regular basis with NHSN reporting. So what I want you to go and walk away from today is I'd like for you to be able to, if you don't have access personally, if you're on the call right now, if you're not the administrator, director of nursing, or MDS coordinator, and those are the disciplines usually who have access to the keys and iKey system. If you don't have access, go and talk with your administrator or director of nursing or MDS coordinator. Make sure that they're able to log in and can generate these QRP reports. If your MDS submissions are timely, make sure that they're timely and completed. If your threshold is below 90%, work on completing that today to try to get those up to 90% before the deadline tomorrow. Make sure that you're completing your MDS, your NHSN data submissions each week, as well as your annual influenza data for your staff. Again, many facilities continue to struggle with this. And if you're noticing that you're not meeting a lot of these SNF QRP measures, focus on quality improvement efforts and system issues which are preventing you from meeting these measures. So if it's like MDS where you're having having to skip sections and put dashes, that might be related to some documentation issues where staff are not putting in the information for the MDS coordinator to fill it in. So focus on a system level and look at what's preventing you from meeting these QRP measures because again, you should already be doing these things and there isn't anything additional that you should be doing. You should already be meeting these measures. So if you aren't, that you need to be looking at the systems that are preventing you from meeting them. And really, the biggest thing you could do is to create that culture of quality improvement, and we at the QIO can assist you with that. There are some additional considerations that I'd like you also to be aware of. CMS over the years has continued to transform from being that passive payer to more of an active value-based purchaser by implementing these various payment mechanisms and rewarding measured entities who achieve those better quality outcomes. So really focus on quality in your systems. And by doing that, you also need to have an understanding about what all these systems are and how you're being measured behind them.
Josh,
Yes,
could you go back 2 slides?
sure.
There. On this slide, one of the things to think about when you're doing this information, particularly when you're looking at your MDS submissions, is the time frame that is in this current report. Because if you look at the MDS, it's good if you work on your MDSs that you submitted last month, but the time frame is the first quarter. Is that correct?
Yes, so they are looking at the thresholds for your Q1 2024 MDS submissions. So everything from January 1st through March 31st, all your MDS submissions within that period. Those are the ones you should be focusing on to ensure that you have all the required data submission elements in that MDS so you can have that 100% completed MDS. So you can work on increasing your threshold to at least having 90% of your MDSs being 100% completed.
Yeah. Joshua, just a clarifying question, the CMS quarters are different than calendar year quarters. So is it the CMS quarter one or is it the calendar year quarter one? Because CMS quarter one starts in October.
Yeah, so I believe it's Q1 2024, but I will double check and I can send out information related to that question after this call to everyone who attended.
Okay, we've got a question in chat. Can you provide instructions on how to get the QRP reported IKEys? And they said they can't find the report.
Yeah, so when you're in the iKey system, there should be a report that's called the SNF QRP Provider Threshold Report that you should be able to generate. I don't have access to the keys in iKey system, and I wouldn't be able to tell you what specifically the steps are related to that. But you should be able to log into the iKey system and be able to generate that report within there.
And there is an iKeys user manual that I believe has step-by-step any instructions within it. And the other thing is, if you'll notice, it says FY 2026. So if you're thinking calendar year 2024, you're not going to find this report. You're not going to find the correct report.
Yeah, because right now, 2024 is the fiscal year for 2026 quality SNF QRP. So right now, you're being measured on your 2026 adjustment. Any other questions or anything before we move on? I didn't have too much more. I do have a bunch of QRP resources, and I'll be able to provide the slide deck to everyone who's attended as well, so that they can utilize these resources after this call today. Yeah, so Leela, thanks so much for putting that in the chat. So Leela shared that to find the report in iKeys, you can click on the Find a Report option and then type in the keyword threshold. And then by doing that, you should be able to generate your threshold report. And if you've generated your threshold report and you want to talk with us about it, have a conversation separately after this call as well, you can contact any one of us. We're here to help you, work through this. Some of the inquiries that we've been getting from various different facilities. I had a facility reach out to me last week when they generated their threshold report that showed that they met the MDS threshold, but on the second page of that report, it actually shows whether you've met the NHSN reporting threshold as well, the NHSN reporting requirements as well. And what ended up happening is I looked, it showed that the facility did not meet those measures. And so when I went to go and pull their publicly reported data for NHSN submissions, and if you're not already aware of that, that's a conversation for another day. There's actually on the data.cms.gov website, you can look at every single facility's NHSN data submissions. So I looked up this facility on that database, and it showed that there was nothing reported since the beginning of the NHSN requirement, which did not make any sense to me at all. I can't imagine any facility that has gone that long without submitting any NHSN data. And it turned out that their CCN effective date was incorrect in NHSN, which was preventing CMS and the CDC from having correct information about that facility's data. What's very important to know that in NHSN, your facility's CCN, your CMS certification number, and your effective date needs to match exactly to what CMS has. Otherwise, it's going to cause issues in them being able to generate your facility's data. So that's something to consider as well. And you can look and find out what your facility's CCN is and the effective date on the QCore website. I can put a link to that into chat in just a second. And then lastly, you can actually contact CMS to review your provider preview reports for the QRP. This is the email that you can use. Your email, I have instructions on what your email needs to include, and you can do this. Probably it's too late now because the deadline's tomorrow, but going forward, it's useful to have this information when we're at the next QRP measurement period deadline, so that, a couple weeks before then, if you have questions about your provider reports, and that maybe any discrepancies, something that you don't understand, you can actually reach out to this email and that can provide you some additional information related to that. And again, I'm going to be providing this slide deck to everyone on the call today, so you'll have access to this. And that's everything that I've had planned that I wanted to share. I'll open it up again for some questions while I get some of those links that I mentioned and put them into chat for folks right now.
The information was good. They said it helped and they got their report.
Okay, perfect. So I just put the QCore web homepage website into the chat as well. You can search at the top left and search by your CCN. And then once it comes up with the result, you can click on that link and it can show your CCN effective date. So just make sure that that effective date and the CCN match exactly what you have in your NHSN in your NHSN profile. Otherwise, it's going to cause issues related to your reporting and how they're able to pull your facilities report. And I put the presentation into chat for download. Yeah, let me try that. Okay. So right now. Yep. All right. I just put that into chat, and it's downloading right now to upload, and should be all set. All right, so I put the slides in the chat. Anyone can download them right here. I'll also send them again to everyone after the call, just to be safe to make sure that you all have this information. So I'm hoping all you folks today are able to pull that report, see where you're standing with your MDS thresholds and your NHSN submissions. Um, reach out to us if you have questions. But I wanted to get this information out ahead of time before the deadline tomorrow, to make sure you are able to make any last minute adjustments and changes before the period. And then I will double check to find out that it's calendar year quarter one that they're looking at. That's what I'll double check on.
And then, Josh, we always ask if this was helpful and if there are any other topics you would like us to present. Please put your ideas in chat.
Yeah, I would love your feedback and your thoughts. Yeah, Leela shared that there's also additional reports that you can run for error reports that can help you identify who is triggering for as it relates to the measure. So that's very helpful information as well. All right. Well, that'll be it for today. Thanks so much for joining, everyone. And again, if you have questions and about your reports, anything, we're here to work with you. But please do take some time today to take a look to make sure that you're in good standing. All right, perfect. Leela, thanks so much. I'm going to include that actually too in the follow-up email for that if they want to run an error report to look for those specific numbers. You've been a big help. Thank you.